Hi, my name is Molly Ostrander, and I am in the DCN, Doctor of Clinical Nutrition program at Maryland University of Integrative Health. This is my presentation and my literature review on exploring the safety and optimal duration of probiotic treatment. Okay, so today we're going to talk about the regulation of probiotic supplements in US and global markets, identity and safety of these supplements, and the benefits and risks of these supplements. We're also going to go over recommended duration of probiotic treatment per the literature review, which is really my question here. How long should I be telling my patients as a dietitian to take probiotics? Future implications. So, what do we need to do as researchers, scientists, and healthcare providers? And some conclusions. This presentation is made for functional practitioners who prescribe or recommend probiotics to patients, really anyone who prescribes or recommends probiotics to patients, physicians and pharmacists who want to answer questions about probiotics or also understand a little bit more about what's going on there. So I hope this helps you. All right. The formal definition of probiotics, live microorganisms that, when administered in adequate amounts, confer a health benefit to the host. Now, that was established by the FAO and WHO expert consultation, and they wanted to kind of understand the term probiotics. And this has been used by regulatory agencies, consumers, and more for over 20 years. You can see that research has really had a steep increase here steep increase here in the past couple of years. Now, when something is called a live microorganism and not a probiotic, then there is still going to be a theoretical list of risk of live organisms. That means like they're going to have a long-term impact on microbiome, immunity, cardiometabolic, and other physiological parameters that do deserve further discussion. Very few studies follow these cohorts long term. So we're looking at 8-week studies for the most part, right? That's what we see, and then they stop and they don't follow up with them. The endpoints, not necessarily clearly defined. We'll get into that. Now, if you call something a live microbial, it's still a live microorganism, so it still has that theoretical risk. But according to the United States, a live microbial does not infer a health benefit. So there's not going to be as much regulation because what I found is that the regulation is really based on what the claim is and not so much what's in the pill bottle, which is, less than ideal. Dietary supplements are, of course, going to comply with the GMP guidelines, but you don't have to get that seal. You don't have to pay for that voluntary seal with the dietary supplement. It's really more, are you making that claim? So we'll get into that. And, I don't have to tell you, by 2026, this probiotic market is expected to reach 9.1 billion US dollars. So no surprise there, right? Hmm. All right. Well, you'll have to forgive me here. I'm doing my best. All righty. Background. Probiotics were developed in 1900 when we discovered the lactobacillus in fermented dairy. And an imbalanced microbiome, as we're starting to know more and more, has been linked to a ton of conditions and syndromes, over 25. Now, there's a large body of preclinical and clinical research on the GI benefits of probiotics in healthy individuals, and lots of minor and serious health conditions that include going to be, of course, diarrhea, antibiotic and regular, IBS symptoms, treatments of hepatic encephalopathy, symptomatic relief in IBS, prevention of necrotizing enterocolitis in preterm infants, treatment of UC, ulcerative colitis, and pouchitis. And actually, probiotics are in some major clinical guidelines, but they are missing from some other major clinical guidelines. The probiotic umbrella, so like I said, unless they make a specific disease related claim, probiotics are regulated as food supplements, and that regulation is based on that claim. The probiotic umbrella concept is commonly promoted by the probiotic industry. The umbrella concept seeks to take advantage of results obtained with a specific probiotic and apply them to all others. So Bacillus does help create neurotransmitters, right? But we could have a bifidobacteria formula and say this reduces anxiety or this helps with depression. Just because it's a probiotic, regulation hasn't caught up with the strain specific benefits. And this muddies it for all of us, right? Practitioners, consumers. What's the dose? What's the duration? What even is this doing? People think, oh, I got to take probiotics all the time because it's going to help me lose weight. It's going to boost my immune system. It's going to regulate my bowel movements. It's going to clear up my skin, and it's going to get rid of my anxiety. When in fact, you would have to take a tremendous amount of different strains to get all of those benefits. So that is, you know, a lot under that umbrella. Of course, the most well-studied strains are going to be Bifidobacterium and Lactobacillus. Oh, yes, okay. Um, in terms of regulation, there is no global regulation for requirements of safety. So efforts are underway, but they have not made it yet. The USP is the United States Pharmacopoeia. It's a nonprofit standard-setting organization for medicines, foods, and dietary supplements. USP certification is voluntary. It's a verification that you have to pay for that shows that the supplement has followed GMP practices and that what's in it is actually what they say is in it. Now, the USP developed an expert panel to advise on quality requirements specific to probiotics, and now they're pursuing more standardized safety standards too. So I'll be interested to see in the next couple of years how this develops in the United States. You can see globally here other organizations involved in probiotic safety. The World Health Organization, we've got the European Food Safety Authorities, Quality Presumption of Safety Initiative guidance documents. The EFSA has definitely rejected all submitted health claims for probiotics. So they're not into that. And they also are very into antimicrobial resistance. So really concerned with safety in Europe, especially when it comes to these antibiotics. And we'll get into that. IDF is the International Dairy Federation, which focuses on microbes that have a history of safe use in food. Of course, the SGA does kind of talk about, is this generally regarded as safe? And again, that is not necessarily something that has to be, but they say, oh, great, well, it's good enough, right? International Probiotics Association, they have guidelines to qualify a microorganism to be deemed as a probiotic, which briefly describes several approaches and requirements from different authorities. And then we've got the International Scientific Association for Probiotics and Prebiotics. They published 2013 guidelines for regulators, and their website's great. It's got a lot of information. They offer a membership, so at least to help to educate the practitioner. But again, in the United States, it's just the USDA. Sure, the FDA is involved, but as you may know, the FDA really only talks about claims. So, well, I'll get into that later. There are no harmonized requirements among these regulatory agencies. So I looked at 16 peer-reviewed articles, and I tried to consolidate this as best I could. So bear with me. Got a little bit of the mad scientist vibe over here at Women's Gut Health. Now, the first study is talking about critically ill patients. Basically, what they saw was that the mean count of beneficial bacteria was lower, and the mean Pseudomonas counts, overgrowth bacteria, specifically Pseudomonas, was higher in critically ill patients. And those beneficial bacteria in the Firmicutes and Bacteroides phyla were replaced by those Pseudomonas. So the change in microbiome is due to, of course, the antibiotics. That's going to result in loss of beneficial bacteria to the gut, as well as some of the overgrowth bacteria. And, of course, we want antibiotics, but it's also going to give us diarrhea. So diarrhea has a whole other set of outcomes involved with it, such as poor wound healing, electrolyte balance, fluid losses, hemodynamic instability, and deficiency of nutrients. Now we see that Aspergillosis would be the most efficient fungus for preventing antibiotic-associated diarrhea. And actually, it has a pooled relative risk of 0.5, with 10 patients needing to be treated for one person to recover from that antibiotic-associated diarrhea. It's actually pretty good, but Aspergillosis is a fungus, and we do want to use that with caution, as you'll see. Now, the next one looked at colorectal cancer patients. So the authors say, listen, modulating the microbiome post-surgical is really helping these people. It can result in changes like It's going to reduce some of that fermentation of bacteria, which is going to improve intestinal motility. And that is going to help to decrease that pH, which is going to shorten the transit time of intestinal contents. We did see that the probiotic arm of this study did better. They had improvements all across the board, but the only significant, so the largest reduction in complications postoperatively were in the rectal region and the ascending colon. Significantly reduced complications would be ileus. And so all other post-op complications were reduced, but not significantly. But with ileus, you're more likely to die if you have an ileus. So mortality was 4 times more common in patients with colectomy who had an ileus versus patients who didn't. So, and that P was 0.001. So very significant there. And how great that, we do see this. But again, we're giving a live, unregulated microorganism to someone who just had their colon removed. Like, okay, premature infant death, it's rare. There have been actually a couple different reports of this, but most of them are case reports. They're not, like the majority of what I saw was in, let's say, an anecdotal kind of thing at the bottom. But we weren't really saying like, okay, we measured these endpoints and this is how many infants died and this, that kind of thing. But there is one in this Sanders review. A dietary supplement was administered to a premature infant. And, think back, I said they're using it for necrotizing enterocolitis in premature infants. So one of those infants, probably they're trying to save the life, died from an infection caused by mold. And that species of mold was recovered from unopened bottles of the probiotic that the infant was given. And it was also found in fecal tissue of the infant. So, all the more reason for us to have some regulation. Now, the Propatria study of 2008 showed higher mortality in the probiotic arm than control. Obviously, this is quite an old study, but it is still cited with caution. And I felt the need to bring it up because we're talking about safety here. So essentially, they wanted to see, can we improve the quality of treatment of patients who have acute pancreatitis? And see if enterally administered probiotics are going to reduce infectious complications. So they gave them extremely safe probiotic bacteria in their enteral feeding. Of the 300 people in the trial, they figure, okay, 10% of these people are going to die due to the natural course of the disease anyway. So about 30 patients they expected to die. Our results show that 24 patients in the probiotic group died, compared with only 9 in the non-probiotic group. So 16% versus 6%. So that's pretty significant. And there were 6 deaths less than they expected in the placebo group. And there were 9 deaths more than they expected in the probiotic group. So that's something for us to all remember, right? Even when it seems like, oh, this will help. This 2014 consensus statement is a little outdated, but these benefits are still relevant. Probiotics do normalize disturbed gut microbiota. Now, can we really crowd out all that overgrowth or all that yeast? Not necessarily, but certainly it's going to help to bring up the probiotic bacteria levels. Helps to regulate intestinal transit, remove pathogens, produce short-chain fatty acids, and other postbiotic end products. The consensus panel stressed that claims for a number of such medical benefits can only be made in the strains for which they have been demonstrated. So, not every probiotic is going to remove pathogens. Something to, again, keep in mind, right? Looking on, in a meta-analysis of critically ill patients, we didn't see a difference in mortality in the ICU. So even in these critically ill patients, except for that pancreatitis study. Adverse events over 50 years of research, no statistically significant increased risk of experiencing adverse events in health compromised patients or critically ill patients was found. So over all 50 years of those studies, they did not see any increased risk by giving probiotics to critically ill. Authors can't make general recommendations, but they also conclude that the use of probiotics in children seems to be safe in general, even when provided in high dosages. Now, in terms of adverse effects in at-risk populations, this actually, again, some of these are case reports, especially with some of these infants. Bacterial sepsis is pretty rare. So they found 2 cases of patients who had received lactobacilli and subsequently developed bacteremia and sepsis, attributable to lactobacillus species. And that exact same species they found in the blood. So what does that mean? That it translocated out of the gastrointestinal tract, through through that intestinal permeability, more than likely, right? And caused a deadly bacterial sepsis infection. Now, S. boulardii has been reported to be associated with fungemia in critically ill patients, as well as in immunocompromised individuals. And there have been some case reports of, again, that fungal infection in preterm infants. So that I don't know as well, if it was because of the intestinal permeability or not, but that was a case report that was brought up in that review there by Dixon. Now, in 2023, some authors administered lactobacillus strains daily to rodents for 8 months. This study resulted in several important findings. So here we go. Long-term probiotic supplementation. This was one of 3 articles that I found that followed patients for longer than 6 months, and these are rats. So it doesn't even, anyway. They found changes in serum biochemical parameters. They found a systemic pro-inflammatory response. So they measured that by seeing increased serum and tissue inflammatory cytokines. They found enlargement of lymphoid aggregates in the colon and changes in that fecal microbiome composition. Short-term probiotic administration resulted in changes of the percentage of blood innate and specific immune cells. So what they said in the study was, hey, things were all set like for the first 8 weeks and everything looked great. And the probiotic group was doing much better than the control group. But then after 8 months, we found that the probiotic group actually fared worse than the control group. They had more cardiovascular risk factors, they had more inflammation, they had a more activated immune system. And that has made research nervous as well. Now, there are not a lot of other studies like this, and I'll talk about this later, but rats are not the best in terms of this kind of thing because their intestines, like the pig's intestines, are going to be better than rats' intestines for us to really compare apples to apples. But still, these are animals and they're not people. So it's not really apples to apples, but this is something to keep in mind. Okay, identity and safety. So to identify the strains of probiotics in the bottle, so let's just this. So we have a bottle of probiotics. To identify what strain is in here, we're going to use whole genome sequencing. Across the board, everybody agrees that that's the way to go. This looks for antibiotic resistance, virulence factors, hemolytic activity, and toxins. So we definitely don't want any of those things, right? And I'll talk about that more coming up here, but probiotics are only considered, so strains are only considered safe if they do not contribute to functional antibiotic resistance or fungal, like antifungal resistance. It's got to also have supporting research and it can have known inherent risks. Now, in the case, like, so this is a pendulum product in my hand. And in the case of that, like most of the research about these pendulum formulations is sponsored by Pendulum. So I don't know how crazy I am even about the supporting research. Like there should, I think, be more parameters around that too. But there are no parameters. So I'm just like making this up here on YouTube for you all. Now, dead bacteria. So they're inevitably going to be present in probiotic products, right? Because of the manufacturing, the harvesting, the degradation process, and of course, then shipping, storage, all of that. Now, dead bacteria are going to accompany the live probiotic bacteria. And so to maintain the advertised number of live bacteria, it's common practice to overfill each capsule or packet or, formulation with excess bacteria and assume it's going to die during storage. But now there are some people coming out and saying, and some researchers looking and saying, hey, these dead bacteria are translocating into the bloodstream and the lymph and the rest of the body. And now we have dead microorganisms floating around from God knows when, which is not good, right? So that's also something to think about. Have you ever even thought about that? Because I certainly hadn't. Now, this really freaked me out. And so I want to take a minute and just make sure that we all hear and understand this. So with my patients, I have a private practice. With my patients, I run all of them through all their medications and then any supplement they're taking and any supplement I would like them to take through the natural medicine database interaction checker. Because I certainly don't want to have any cytochrome P450 interactions. I don't want something to be taking away from their pharmaceutical. I don't want something to be taking away from their supplement, you know. So when I read that lactobacillus prevents vancomycin from binding to cell walls, in a time when my one of my family members is on vancomycin and definitely needs a probiotic at some point here, I was shocked. And so I put that into the natural medicines database, and sure enough, all it says is that vancomycin will reduce efficacy of lactobacillus. That is actually not the whole story. There was also something going on with tetracycline, and that is on another slide, but bifidobacterium um, can lead to tetracycline resistance as well. So just keep that in mind. Tetracycline and vancomycin, be very careful with those because we certainly don't want someone who needs one of those antibiotics to not get it. All right, medical foods are not drugs. So, well, let's go to trademarks first. Any probiotic, even untested, can be sold under a trademark that was used in the past to refer to a formulation well known for origin or safety or efficacy. So I've got my Pendulum Akkermansia blend. Let's say tomorrow someone comes along or Pendulum decides to throw in a different formula that maybe doesn't have Akkermansia in it. I'm using this Akkermansia blend because I love the Akkermansia aspect of it. I wouldn't even have the opportunity to assess that because they don't have to disclose it. I hate to beat up on Pendulum. I just happen to have their product here because I love them. But it's just an example, right? So trademarks don't protect anything, which is really weird. Medical foods are not drugs, but probiotics are medical foods. So they're not subject to any regulatory requirements in the United States that would specifically apply to drugs. However, a medical food that bears false or misleading claim would be considered misbranded under Section 403A of the Food, Drug, and Cosmetic Act. Guess when that act came out? 1938. Like, what? So, not only can you do whatever you want, throw a bunch of dead bacteria in here, maybe you should identify the strain, but who's really going to check if you do? You certainly don't have to say, don't take this if you're on vancomycin. But the only thing that we seem to care about is don't say that this causes weight loss unless it actually causes weight loss, or you're going to be in violation of a branding act from the 30s. I just, to me, that blows my mind. All right, I think that's that. So in Europe, this is what they use: phenotypic and genotypic analysis of antimicrobial resistance genes for consideration of strain safety. So this is an attempt to provide a comprehensive approach to determine is there going to be antibiotic resistance or not. And there's nothing like this in the United States. All right, proposed safety. So what could there maybe should be in the United States based on now what we've heard about all of this? So Merstein and authors define a safe probiotic as one that, of course, is not going to contribute to resistance. It's not going to create a chemical, it's not going to create these amines. So certainly histamine, tyramine, we don't want to, if someone's having issues with those, we don't want to give them a probiotic to help them and have it actually create more histamine or tyramine like reactions. We definitely don't want it to degrade that beautiful mucin of the gut lining, because certainly if we're prescribing a probiotic, we're probably doing it corresponding with some other interventions to help to build up that mucin layer. We don't want heavy metals or aromatic hydrocarbons or allergens or microbial contaminants that find their way into the supply chain via raw materials or in the processing, plant or as end products to be in these pills or in these powders or in these, whatever. So definitely don't want that either. We don't want it to create lactate, which can, of course, contribute to acidosis, specifically in infants with short bowel syndrome, who we do use probiotics in a lot, especially preterm infants. Now, we want to make sure that these probiotics have been studied on biologically relevant animals, so that would preferably be the pig. I read in one article that a year of a rat's life is like 3 years of a human's life. So if we're studying rats, for example, in that one study for 8 months, then how long is that in human years? And does it really, I mean, not that pigs live to be 72.5 years old, but I think you understand what I'm saying. We definitely don't want pathogenic virulence if the microbes do translocate, dead or alive, right? And again, if we have, so I'm a gastrointestinal dietitian, certainly all my patients have a compromised gut barrier, and I definitely don't want them having anything that's going to translocate and then cause something else to happen in the body. And yeah, I would love it if we could all create these things in a GMP approved facility and have that be something that has to be proven and shown and tested and third party tested again. Now, this is a proposal chart to define significance of a history of safe use at the species level, and it would define what initial testing should be completed before the probiotic strain can be considered safe for consumption. So a little more simple than what they have going on in Europe, but this is a 2015 decision tree, essentially, and it's still not in practice, but should be. All right, how long are we giving these probiotics? So I still don't have an answer for you guys, and for that I apologize. Now I do know that in one study, probiotics were shown to be the probiotic arm and the control arm, no probiotics, just placebo, had similar improvement in their IBS, GIS scores and their other symptom severity scores at 4 weeks. So it wasn't, they were both like, yes, I feel way better. But then after 8 weeks, that real significance, you can see by that p-value in this graph here, did come in the probiotic arm. So 8 weeks, I think any study you look at is about 8 weeks. So we do feel good about that. High risk preterm infants that were given Lactobacillus bifidobacterium for about 4 weeks did show some colonization up until 18 months, but not past 18 months. So, I mean, this is going to raise a ton of questions like, okay, well, do they need it after 18 months? Should we take it for 8 weeks every 2 years? Like, what would be the endpoints? What's the dose? What's the formulation? All of that needs to be determined. And we'll talk about that in the next slide. In a study of colonization route of probiotics from the oral cavity to the intestinal tract and then to the vagina, we didn't find that colonization in the vagina in this study, but another study did find colonization in the vagina. It was after 6 months, and this one was after 1 year. Now I know that similarly, we look at colonization and say, well, even though it's not colonizing, it's still working. Again, what are we doing about that, right? Do we want a colonizing probiotic? Do we want to know what colonizes and when to colonize it and when to use it? Yes, I think that would be nice. But for right now, what they did find in these women with these two strains is that the women who did not have dysbiosis, they had similar levels after a year, but the women who did have dysbiosis had a much healthier, much better microbiome. So I thought that was pretty interesting. Now, looking at, again, that rat study, so inflammatory cytokines, they're thinking maybe long-term probiotic use could lead to a gradual health deterioration because if rats really do, it's like 1 year for them is 3 years for us. I mean, rats live that long. I guess I need to learn more about rats. Then, theoretically, we're looking at maybe 2.5 years of a person, and they're saying it deteriorated their health. It increased cardiovascular risk indicators, and it definitely did promote gut inflammation. And that was increased by an abundance of the inflammatory bacteria in the gut that they found. And those were significant findings. So I do take that into consideration, especially with that being a newer study, but I'd like to see it repeated on pigs and on people. And then lastly, there was one study with the infants, and they also didn't find that this probiotic species persisted 2 years past supplementation, but they did find that compared to infants who had healthy microbiome and who did not receive probiotic supplementation versus infants who had healthy microbiome and did receive probiotic supplementation, after 2 years, the people who didn't get probiotics or the kids who didn't get probiotics had a more rich and diverse um, microbiome. So does that lead to the question that maybe the microbiome should be left alone to an extent? Certainly long term, maybe a little more harmful. So why would you even give somebody probiotics? We know why. Positive effects on symptoms, disease, disorder. It's well documented, especially in those two lactobacillus, bifidobacterium strains. Now we're learning even more about the mental health, which is awesome. It certainly can help with diarrhea and IBS symptoms. Now, the study that I cited here did not find that to be conclusive in critically ill, but then there were other studies that did find it to be conclusive. Um, Patients in the treatment group, I mean, we know probiotics are going to activate their immune system, so that's something to think about. But be careful, especially with HIV, especially with immunocompromised individuals. Oh, I'll talk about that on the next slide. Um, some studies report significantly lower incidence of infection, especially postoperatively or in the critically ill with people who do use probiotics. There's significantly reduced rates of ventilator-acquired pneumonia in several meta-analyses. It can reduce inflammation, but then again, can it cause inflammation? And it can also reduce pathogens and regulate adaptive immunity. But again, it can also trigger that adaptive immunity to be too high. So what are the risks? I know that wasn't very good for the benefits. I guess I'm just in it. So the optimum dosage and strain, we don't know what that is. We don't know how long, we don't know what strain, we don't know how strong the strain should be and how many dead bacteria should be in it and where it should be produced and who it should be given to. That's a big problem. We need to use human studies to assess human safety, right? And certainly at least pigs, but there's not a lot on pigs. It's like mostly rats. There is no consensus or standard operating procedure. So, like in all of these studies, even the ones where they did follow up for longer, they're like, yeah, some people like did say they had diarrhea, but they like wrote us in and told us or called us on the phone. There was no formal reporting standard. So, they're not really assessing adverse events. Now, there is the hotline that you can call to report them, but in these case studies, there should be some kind of monograph where every single person has to, you know, do this checklist. Now, that of course, then is it too bureaucratic and does it take away? But I think that there should be some kind of like, okay, did you get bacterial sepsis? Did you get some kind of fungal infection? Do you have leaky gut? Did your diarrhea get better? Did it get worse? Did it get better then worse? All of this stuff, it needs to be standardized so that we can compare apples to apples. And we don't have that right now. And it doesn't even, it really seems like a big mountain to climb in terms of lactobacillus vancomycin, bacillus tetracycline. Be careful because I didn't know that. And, I'm like, oh, I didn't know that. But I mean, I don't think that that's something that is talked about enough. And if you're going to be working with critically ill, so if you're watching this and you work in a hospital or you work in acute care or long-term care or skilled nursing or something, is that part of your training? Should that be part of your training? ASPEN, so the American Society of Parenteral and Enteral Nutrition, does not recommend the routine use of probiotics, which was surprising to me given the amount of studies that they do on necrotizing enterocolitis in preterm infants. The safety of probiotics is inconsistently reported. So, endpoints, but even during the study, like did they do genome sequencing? Did they look at what was in the probiotic? Did they look at, how many live, how many dead? There's so much, and this is a live organism, right? Like there's so many things that are not being monitored or regulated. Again, I think I've talked enough about adverse events, but remember, small sample sizes, these longer term studies, like there aren't big cohort studies, there are no landmark studies, there's nothing that really like gets a bunch of people together and measures the same thing in all of those people in terms of safety. We're not looking at IBS symptoms. We're not looking at vital signs. We're not looking at immunity, and those things should be measured. We're not looking at inflammation, right? Like that, everybody's highly sensitive CRP, everybody's calprotectin, like none of that. Obviously, the major risks are going to be bacterial translocation, microbial resistance, short and long-term immune activation, and then those metabolic activities. So is this causing lactate? Is it going to lead to acidosis? Is this going to actually deconjugate bile salts and make digestion impaired? And then, are we going to have more issues in terms of um, at-risk populations? So HIV, um, someone who's on a biologic, there were some calls to say, hey, let's put probiotics in the same class as biologics because they're similar. They're both living organisms, and probiotics should be as regulated as a biologic is. But you don't want to just give someone who has an immune disorder or disease a live microbial and hope that it doesn't leak out of their gut because I feel like it is. So that, and then critically ill, young kids, old people, we just want to be careful. We really do want to use caution, and I'll use much more caution in my practice as a result of this. So, what do we need? I mean, society, we need to demand for more insights in probiotic safety. So, consider this my demand. The media should get involved instead of, I feel like, the media drives all this marketing. And of course, they're driving sales of probiotics because everyone thinks that they're going to help them with all those benefits. And it needs to be more clear. We've got to really kind of break down that umbrella for people so that they understand what they're getting and what they're not getting. And scientists and researchers like myself need to be more involved and say, hey, maybe I should reach out to Pendulum and say, what are your safety endpoints? How many dead bacteria are in here? Where's your whole genome sequencing? That sort of thing. And then we do need databases, ethics committees, all of that. So it is a shared responsibility. And I hope that if you're still watching this, that you agree and that if you know someone, you can talk to them about also the safety of probiotics. So in conclusion, be careful, case by case basis. Now, we do see that there's plenty of benefits, especially in healthy people. But I think some of these more potent or novel strains or powerful strains or, um, you know, polypharmacy is not going to be in healthy people. So I think it's important to remember this as we go forward in our practices. Findings related to probiotics are strain specific. So make that clear to your patients, make that clear to your employees and your partners and your colleagues. Like, hey, just because probiotics do this doesn't mean that this probiotic does this. There are not enough studies on safety. There is not enough regulation on safety, and it's a high risk situation, especially with all that we're learning, recent research about intestinal permeability and lipopolysaccharides. Like, how could this not be in that same vein, right? And we need a more precise use of the term probiotic because that one is 20 years old. I really hope that you click on this link, and I'll put this link in the comments too of the YouTube video. It has all of the bibliography. It's got some annotated notes. And thanks so much for coming today. I hope that you enjoyed this presentation. Again, I'm Molly Ostrander, registered dietitian. You can find me on Instagram, TikTok, Women's Gut Health. You can find me here on YouTube, kind of. And see you soon.